If you're over 50, please listen carefully. Multiple sclerosis does not always begin with obvious neurological symptoms. In many people, the earliest changes don't feel like a brain or nerve problem at all. They feel ordinary, easy to explain away. That's why MS is often missed for years. Not because the signs aren't there, but because they don't look neurological at first. In this video, I'll walk you through the early MS symptoms that are most commonly dismissed and why doctors pay close attention when they appear together. When people think of multiple sclerosis, they usually imagine clear nerve problems, numbness, weakness, vision loss. But MS often begins much earlier than that. In the early stages, inflammation and disrupted nerve signaling can interfere with how the body regulates everyday systems, long before anything obviously neurological appears. That's why many people with early MS spend years being told their symptoms are stress, hormones, aging, or anxiety. Let's go through the signs that are real, documented, and commonly overlooked. The last one is actually verified by real viewers on our channel. So stay with me to know what it is. Sign number 1, a sudden drop in heat tolerance. For many people, this is the first change they notice. And it's subtle at first. Warm environments that never cause a problem suddenly feel draining. A hot shower leaves them wiped out. Warm days bring brain fog, weakness, or the need to sit down. They find themselves needing air conditioning while everyone else feels fine. This isn't about simply not liking heat. People often say, "I just can't tolerate warmth the way I used to." MS research explains why this happens. Heat slows nerve signal transmission in everyone, but in early multiple sclerosis, nerve insulation is already damaged, making signals less efficient. Even a small rise in body temperature can temporarily worsen symptoms. This effect is well documented, but rarely connected to the nervous system by people experiencing it for the first time. Sign number 2, a strange, unexplained internal vibration. This symptom often stops people mid-sentence when they try to explain it. They describe a buzzing, humming, or vibrating sensation deep inside the body, like a phone vibrating internally. There's no visible shaking, nothing anyone else can see. Because there's no outward sign, people are often told it's anxiety, stress, or caffeine. Over time, many stop mentioning it altogether. But research into sensory nerve disruption in MS shows that early changes can create false internal sensations without visible movement. The nerves misfire, sending signals that don't match what's actually happening in the body. This symptom is frequently reported within MS communities, yet rarely discussed elsewhere. When people finally hear it described, the response is often the same: "I thought it was just me." Sign number 3, sudden, unusual fatigue after mental effort. This is not ordinary tiredness. People feel completely drained after conversations. Concentrating briefly leaves them needing to lie down. Mental tasks feel physically exhausting, far beyond what seems reasonable. That imbalance is the key detail. MS-related fatigue is neurological, not muscular. Research shows that when nerve pathways are inflamed, the brain has to work much harder to complete routine tasks. That extra effort burns far more energy, making mental activity feel physically depleting. This can happen long before scans or blood tests reveal anything abnormal, which is why this symptom is often dismissed, despite being one of the most common early features of MS. Sign number 4, brief electric shock sensations with movement. Some people notice a sudden electric sensation that runs down the spine, into the arms, or into the legs. It may happen when bending the neck forward or shifting position. It lasts seconds, then disappears. Because it's brief, many people ignore it. Neurologists recognize this pattern because it reflects how inflamed nerve pathways in the spinal cord respond to stretching. Research shows that damaged nerve insulation can distort signal transmission when the spinal cord is briefly stressed. This isn't a muscle or joint issue. It's a neurological signal disruption, even when symptoms don't last long. Sign number 5, Unusual sensory discomfort with clothing or touch. This isn't numbness. People describe clothing feeling irritating or painful, light touch feeling exaggerated, or discomfort without any visible skin change. The skin itself often looks completely normal. What's happening here is altered sensory processing. Early MS can change how incoming nerve signals are interpreted by the brain. The nerves still function, but the message is distorted. Research into sensory pathway involvement in MS shows that normal sensations can feel uncomfortable or painful as a result. Because there's no rash or visible explanation, this is often brushed off as sensitive skin, even though the origin is neurological. Sign number 6, subtle changes in bladder awareness. This isn't severe bladder dysfunction. It's quieter than that. People don't notice the urge until it suddenly feels urgent. They go more frequently without infection. They're unsure whether the bladder has fully emptied. Many people never mention this to a doctor. Bladder awareness depends on precise nerve communication between the brain and spinal cord. Research shows that early disruption in these pathways can affect timing and awareness long before obvious bladder problems appear. This makes it a common early MS symptom, yet one that's rarely discussed openly, despite its diagnostic importance. Sign number 7, head and eye pain with light sensitivity. One of the most distressing early symptoms isn't weakness or numbness, it's pain. People describe deep, sharp, or electric pain in the head or behind the eyes, often paired with intense sensitivity to light. Screens, sunlight, and even indoor lighting can suddenly feel unbearable. This doesn't behave like a typical headache. Research shows that certain sensory nerves supplying the head and eyes can become irritated early in MS. When those nerves misfire, normal light and movement are interpreted as pain. This is why the symptom can be so disabling, and why many people say it's one of the hardest to cope with, even when routine tests don't yet provide clear answers. Did you know these signs often appear together? What matters most isn't a single symptom on its own. It's the pattern. Research and clinical experience show that early MS often presents with symptoms that come and go, affect different systems, and are dismissed because routine tests appear normal. Clinicians pay close attention to this clustering because it reflects widespread but subtle disruption in nerve signaling, not isolated problems. Recognizing the pattern is often what turns confusion into clarity. So, what will you do with this information? This video isn't about diagnosing yourself. It's about knowing what deserves attention. If one or two of these symptoms sound familiar, that doesn't mean MS. But if several have appeared over time, especially they come and go, it's worth mentioning. You don't need answers before seeing a doctor. You only need observations. Being able to say what changed when it started and how often it happens helps doctors look deeper, even when early tests appear normal. Awareness isn't about fear. It's about being informed enough to advocate for yourself. MS does not always announce itself clearly. Sometimes it begins with changes that feel ordinary until you realize they aren't. If this video helped connect that you hadn't considered before, you're not alone. I share clear, research-informed explanations like this regularly. Focus on early awareness and understanding, not alarm. Now, I strongly recommend watching my other video on the early warning signs of MS. It covers the symptoms that do look more neurological, and understanding both together gives a much clearer picture how MS can actually begin. Watching them back to back often helps people recognize patterns they might otherwise miss.